Talking about three fundamental concerns, and I'll now pass it off to Lisa to begin.
So our first concern is loss of lives due to evidence-based harm reduction strategies. You can go back one. Back.
Thank you.
So I actually had a very traumatizing experience at the high-level segment where on the last day, right before Canada was giving its speech, I found out that my friend Junior, who is pictured here above, died of a drug overdose. So it was a very emotional moment for me, and for me it represents that harm reduction is a human right for young people. It's not something that we're arguing about because we're concerned about rhetoric. It's essential to public health services for young people who use drugs. So this presentation and my whole time here is dedicated to my friend Junior, who passed away last week. So in 2007, when the Conservative government in Canada came into power, they implemented the National Anti-Drug Strategy, which essentially took out the pillar of harm reduction. So we have a 4-pillar approach to drug policy in many of our municipalities across Canada, invented by Donald McPherson, who was in the room. He's right there. He's hiding. Hey, Donald. So effectively, they took out harm reduction completely, and there's no federal funding for harm reduction, let alone youth-friendly harm reduction in Canada. Next slide. So in 2008, unfortunately, the National Anti-Drug Strategy was removed completely from the power of Health Canada, our public health body, and moved to the Justice Department. So the principles included in the National Anti-Drug Strategy include prevention, treatment, and enforcement. There's no reference to harm reduction at all. In any federal grants, if you mention harm reduction, you don't get funding. The previous Liberal government in 2003 implemented the previous strategy, which included all 4 pillars. Unfortunately, the Conservative government has taken this National Anti-Drug Strategy to the next level, and they're trying to shut down essential harm reduction services, which Canada is famous for. A lot of the evidence for the effectiveness of harm reduction comes from Canada, specifically Insight, which is one of North America's only safe injection sites. The federal government has been actively trying to shut them down since they opened. Can you go back one? Thank you. So for Insight, it went all the way to the Supreme Court. In 2011, there was a landmark Supreme Court ruling saying that Insight should stay open. So you can see this is a picture of Insight. It's a very clean, sterile public health facility, which is funded by the government, the provincial government, not the federal one. So since then, the federal government's been very angry, and they still continue to try and shut down these safe injection sites from happening in Canada. So most recently, there's been this Respect for Communities Act, which is Bill C2, and it's basically just adding extra red tape to actually open a safe injection site. So for us in Canada, we've been really disappointed, and this really represents a loss for us, and it shows the war on harm reduction that's happening in Canada. Notably, Julio Montaner, who's the director of the BC Centre for Excellence in HIV/AIDS, was quoted in saying, where does it start? Having said that, the evidence to date suggests that we have lost the war because reality is that Insight is open, but there's not been a single additional site opened across the country. So this is a really huge loss for us in Canada. Next. So this is a tweet from the Canadian HIV/AIDS Legal Network, which we are part of their delegation representing NGOs in Canada. And it basically speaks to the high-level segment, Canada's statement, saying that we did not even mention human rights, opposition to the death penalty for drug offenses, harm reduction, or reducing the spread of bloodborne infections such as HIV and hepatitis C. So this is extremely disappointing for us, and we've been trying to encourage them to actually tackle these issues as an NGO delegation. So our main concern, our second concern, which is addressed by that quote, is that Canada has relinquished its traditional leadership role in drug policy. So we were formerly a leader in drug policy. We were pushing evidence-based public health interventions such as harm reduction. Unfortunately, we've become so regressive that even medical marijuana, which was, I think it was implemented in '96, basically we're rolling back that program, we're privatizing it, we're taking away patients' rights to grow. This is effective of April 1st. And all medical marijuana that's been produced through the old program, and I'm a medical marijuana user, so basically we have to destroy all of our marijuana, including seeds, which are legal in Canada. Cannabis seeds are legal, but we still have to destroy them. So we're just basically really going back in time and not being a leader in drug policy anymore.
So I'll speak to our third concern that Youth in Canada have regarding the Canadian drug policy. And that's ultimately the significantly greater focus on prevention rather than treatment or harm reduction when it comes to dollars that are targeted in that national anti-drug strategy towards youth. So first I'll point out that there were some discrepancies when we were trying to do our research in terms of how much funding actually it goes towards the national anti-drug strategy and how that funding is distributed between the 4 pillars that were mentioned earlier. So you can see that an independent audit that was conducted by some researchers for the International Journal on Drug Policy had the results in the left-hand column, and the right-hand column was what was published by the National Anti-Drug Strategy Evaluation Document. So in order to try and answer our questions in terms of what amount of this funding actually goes towards youth, we look through the National Anti-Drug Strategy Evaluation Document, which describes all the programs that are conducted and also describes the key beneficiaries. So anytime there was a key beneficiary that mentioned youth, next slide, we mentioned it in this document. And also our full analysis is included in a handout which everyone should have received, and the citations are there for your information. So we found that under the prevention pillar, there were 4 key activities, and all of those activities did include youth as a beneficiary. And under the treatment action plan, there was 1 activity which did include youth. So of course there was nothing under harm reduction because that, as Lisa mentioned, is not included as a pillar. However, it's interesting to see that $97.8 million were spent on prevention activities and 1.8 were spent on treatment activities. So this is something that we really feel on the ground as youth that work with or are drug users, especially people who have problematic drug use that are searching out treatment. A lot of the times we feel this minimal dollars that go towards youth targeted treatment when they're looking for recovery homes or looking for spaces where they can deal with their addictions and they're grouped with adults, which is not the most ideal recovery environment for youth. So in addition, next slide please, to feeling a little bit concerned about the allocation of funding towards prevention versus treatment and the lack of funding for harm reduction that is targeted towards youth, we were also concerned about the way that the prevention dollars were being spent. So as you can see, the slide that's up here shows a screenshot from experiment.ca, which was a mass sort of media campaign and a website that was launched by the Canadian government that sort of showed an interactive game that allowed you to try drugs on this eyeball here. So this picture shows that when the eyeball was given cocaine, blood spurted all over the screen, and that's just one example of the way that it's portrayed on this website. And we put this quote here that's from an NGO that also works in drug policy-related issues in Canada, and at the bottom there you see that it says, with experiment.ca, drug information is presented through a neutral lens without preaching negative messages about drug use. So we feel like this does not actually articulate that same message that's in that quote. So, and this is actually something that we've experienced through many media campaigns and prevention tactics that have been used by the Canadian government. And actually we, as CSSDP, did respond a while back. If you want to go to the next slide, please. A website that was launched by the Canadian government was drugsnotforme.ca, which again was trying to show drug information in a neutral lens, but CSSDP did not feel that it was done through a neutral lens, so we launched our own website, notforme.org, to present, and you see there it says just say no, like to know. So we tried to combat that and actually disseminate really neutral educational information rather than what we felt was biased information. So that concludes the third concern. And yeah, great. Next slide, please. Thank you so much for your attention. And we just wanted to especially thank Canadian HIV/AIDS Legal Network and Canadian Drug Policy Coalition, who are both in the room, for helping us get here. This is CSSDP's first time at the CND, and we've really enjoyed it and appreciated their assistance. So thank you.
Thank you very much.